Hello, everyone. It's Wednesday, April the 22nd. Our briefing today, we've got some, all these things are important, but we surely don't have as much to report today as normal, which is good. I guess the first thing I want to lead off by talking about is Workforce West Virginia has processed 8,000 more claims yesterday, and they're still on track to have the backlog completely eliminated by tonight. I know there are those of you that were frustrated. I was too. I tripled the amount of manpower. That wasn't enough, so we tripled it again. And I can tell you that, not that it matters a whole lot to me, but other states have had breakdowns like you can't imagine and lines like you can't imagine. But at the end of the day, we had people at home really wondering how they're going to pay their power bill. And I hope we're getting them paid, and I hope we're getting them all caught up. And it pleases me that we're going to have this backlog behind us. Now, as far as the self-employed workers, independent contractors, and workers that don't have a work history, all of those are going to be able to go online. I guess it's day after tomorrow at 10 p.m. and that'll be opened up to you guys and everything, and ladies to be able to move that forward. Maybe we can put that graphic up on the screen just one second. But that'll be up and available to you at 10 o'clock on Friday night, April the 24th. I want us to go back to one of the first things we did when we said we were going to test all of our nursing homes and everything. We began testing the Veterans Nursing Home in Barbersville under the guidance of our Secretary Dennis Davis. And he has reported to me that out of all those that were tested there at that Barbersville facility, there was one confirmed positive case, and we're all over that. We've tested, these numbers don't make a lot of sense, but we've tested right at 120 people with one testing positive, and this is just the first step of many steps that are going on all over our state right now. To be perfectly honest, that tickles me to death, because naturally with the breakouts that we had at, the initial breakout in the Morgantown area, and then it's been Kanawha County, it's been Wayne County, it's been Jackson County, and those breakouts at the nursing homes have been very, very alarming. And so that's why we went on this basically crusade to test everybody, something that had never been done in the nation before, but now many, many states are following suit. And in fact, the CDC, I think, is on the verge of making that recommendation nationwide. But what worried me was we would find that we have a significant problem in lots and lots of places, and the jury's still out. We've got, as we continue our testing, we'll continue to report to you as to what we find. I want to read this. The West Virginia National Guard has received the emergency measures put in place by the West Virginia Veterans Home in Barbersville in West Virginia, in the nursing home there, in the nursing facility in Clarksburg as well. I guess the bottom line of the whole thing is just this. Anyone that is affiliated with our military, past or present, we all need to go right back to what I have said, and this is not being said in the wake of this terrible disaster, but it's what I've said over and over and over. We especially owe everything we have in life to these people. Our ability to go to Wendy's, our ability to do anything and everything we do, our freedoms to be able to just enjoy this wonderful, wonderful country we owe to so many that oftentimes they've given so much and they ask so little. It's so little. But it really pleases me that our guard jumped on it with both feet. We do have one person, and we're tending to that situation, and that's going to take me right into this. Today, I want to recognize our West Virginia National Guard for becoming the first, and I've said it over and over, but the first National Guard in the country to provide mobile testing for COVID-19. Now, the process of deploying the mobile testing unit starts at the West Virginia DHHR, who will alert the National Guard for the need of a rapid testing response. From there, the National Guard will alert one of the two mobile units, which will deploy within 45 minutes of receipt of notification. They began the use of this trailer today. Now just think about that. Innovation with goodness in West Virginia from smart people that are doing absolutely terrific work. Again, I want to go back and I want to just touch on just this. You know, there's always factions of us that would, you may have individuals that are saying, we need to go all back to work. Let's all go back to work tomorrow. You see protests, in different places of our country. We need to all go back to work tomorrow. In fact, we needed to go back to work weeks ago. And then you see others that are saying, oh, whatever we do, let's don't do anything. We can't go back to work and we can't do anything until September. And in both situations, there could probably be better thought in both situations. Now, the one thing I've tried with all in me to do is guide us through a pathway to keep as many of us from getting sick and as many people from dying as I possibly could. Now, as we move forward, I want to tell everyone just this. You're completely in my wheelhouse when you're talking about economics. And I would tell you that if this nation and this engine doesn't start back, we're in incredible peril as far as what is going to happen to us or what could happen to us with a total economic meltdown. We have to go back to work. We've got to find a way to live with this dreaded disease until we get the drugs or the vaccines to be able to then just go back to life as normal. And in that bridge period that I'm talking about, in which we've got to find a way to live with the disease, what we're going to do is we're going to bring back as much as we feasibly can possibly do with the experts leading our way each and every step. For those of you that may think, well, Justice doesn't want to put us back to work, or Justice absolutely wants to put us all back to work tomorrow, you can rest assured just one thing. Justice wants to put us back to work and wants to put us back to work right now. But Justice wants to put us back in a way that is guided by our experts and guided by what our president is saying and guided by the guidelines that are coming out of D.C. and guided in a way that will make us the safest and the best in the nation that we have already proven to be. It just came out just the other day, West Virginia, of all things, and it is the thing maybe we should be the most proud of. West Virginia recognized for being first in the nation in the way that we have handled this thus far. Now, we need to continue to be first in the nation on how we bring our people back, and we get them back as quickly as we possibly can. Now, the last little follow-up I would say to this is just that. the federal government, through the Small Business Administration stimulus, they came out and they said, here's what we want to do, and I'll make it 80,000-foot flyby. Here's what we want to do. We want to give you, small business, enough money to basically carry your employees and all of their benefits and everything for 8 weeks. 8 weeks. Now, that 8 weeks started maybe a week ago. But we want to carry you and make you whole for 8 weeks. And to those out there on unemployment and everything, we want to backfill even additional dollars, whether it be the 600 or whatever it was, for a period of time to help you as individuals. And in addition to that, we want you, small business, to have the opportunity as we go to the marketplace or whatever the next thing that they're bringing out is. When we go to the next level, we want you, small business, to have the opportunity to be able to take loans that are to be repaid at a very, very, very low interest rate with no payments or no interest for the first year. And all these rules are changing, and they're changing pretty quickly. And on top of that, I want to tell you as small business this: many of you do not think you probably have any business interruption insurance. And the insurance companies, especially these great, big, gigantic insurance companies, they would look right at you and say, you don't have any coverage. Don't stop there. Don't stop there. You know, get your best accountant, your best lawyer, your very best advisor, and push it to the limit. Because many of you do have coverage and you don't think you got it. So I would tell you, from a small business standpoint, the government is giving you forgivable loans. They're giving you another loan package that you pay no interest or no payments for a year. And there is business interruption possibility insurance. From the standpoint of our employees, they're trying to backfill you. They're trying to bridge you through this time. From the standpoint of our state, they have sent us $1.25 billion to try to bridge us through this time. So in that time, what we want to do is get back to work, but we want to do it as prudently as we possibly can. That's what I'm trying to do. That's what my job is. And that's what I'm going to do. I'm done.
All right, thank you, Governor. We're now going to take comments from a few of our panel members. Up first, we have Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 698 men and women on duty. I highlight a couple of things from the past 24 hours. As the governor pointed out, National Guard had the opportunity to support the Office of Veterans Assistance and Secretary Davis and his team in testing at our veterans facilities, and today are conducting sanitization missions and supporting those staff personnel in ensuring the proper techniques for isolation and other things are done to best protect our veterans. Also related to the sanitization piece, I want to point out the work we're doing with the sanitization of masks. Most recently, masks were provided in support of Thomas Hospital and the Thomas system. I want to reinforce to folks that those masks have to pass both a 24 and a 48-hour sanitization test at West Virginia University and NIOSH before they're put back into the system. Highlight a couple of key things. Governor has given us 4 lines of effort to work, and highlight a couple of components that we will focus on over the next couple of weeks in those lines of effort. One is operationalized support to agencies. In that area, our primary focus will be growing epidemiology, contact tracing, and data analytics support to the Department of Health and Human Services Public Health Office, as well as continuing to ramp up our ability to provide testing support to DHHR, as well as our local county health offices. Under population stabilization, we'll continue to stay focused on long-term feeding support for our students, as well as for our seniors. And in addition to that, we'll continue to provide support to Workforce West Virginia and address those issues that the governor highlighted earlier. Under logistics, we'll continue to develop PPE stockpile and sustainment. And fourth, under innovation, we'll continue to work pilot projects and best practices to support businesses and other key facilities as we begin to look at the opportunity in phase 2 to open up opportunities going forward that the governor talked about. In addition to that, we'll continue to work production of equipment and unique supplies, such as working with West Virginia University on the development of swabs made through 3D printer operations. We continue to work hard with our partner agencies and organizations. And on behalf of all the men and women of the West Virginia National Guard, again, I want to thank the citizens of West Virginia for their outstanding efforts in listening to the guidelines that are placed by the governor and the team as we work through this pandemic process. Thank you.
Thank you, General. Up next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Hello, this afternoon. It's good to be with everybody. I'm going to limit my comments to 3 areas. Number one, I want to talk about what we're learning from other parts of the world that are starting to reopen. Singapore, which is a country that has been praised widely as having the best concept because of their battle toughness related to their experience with SARS and H1N1, are now struggling on their reopening. They have a number of people that have come in from Bangladesh and other countries that have introduced new infection, and their healthcare system is struggling. Similarly, South Korea, which also started off very well, also started to have some problems, but the difference is they have tested very broadly. So the lesson that we have taken from this is testing is very important, as the governor has done in his executive order. Testing all of our long-term care facilities for patients and staff is step one. We want to keep focusing on testing vulnerable populations. In Ohio now, the incarcerated population in prisons has started to spike up. So we have plans to extend our testing and to test quite extensively in at-risk and vulnerable populations. The second thing I'd like to point out is that our numbers look fairly good. Our conversion rate is 2%. We do have 27 deaths, which is 27 too many, and half of those deaths come from residents of long-term care facilities. So that really supports the idea that we need to test. And as we remember, up to 70% of people who can spread COVID are either pre-symptomatic, they don't have any symptoms, or they've never been diagnosed. So understanding that is important. And states like California are starting to consider, as we are, looking at asymptomatic individuals to then look for people that could silently spread this disease. The last thing I want to do is I got a request from a wonderful lady named Betty Stevens to explain what surge is, and I'll do it real quick. So the surge is really related to how fast the virus spreads in a population. So the faster the virus spreads from person to person to person, and the more people that are infected by the virus, then instead of spreading that out over a long time, where people who, if they get sick, may come to the hospital one by one, as we've seen in New York City or in Italy, as we saw before, volumes of people can come to the hospital. And that large number of people getting sick at once is what we call the surge. And flattening of the curve, or as we say, reducing that surge, is really slowing down the rate of viral spread in a community. And the things that make that work are staying at home and working from home when you can, staying physically distant 6 feet or more, and if you're out and you can't, wear a face mask or a face covering. Wash your hands 20 seconds, soap and water, or with sanitizer all over, and avoid touching your mouth, your nose, or your eyes. Thank you.
All right, thank you, Dr. Marsh. Next, let's...
Well, hold up for a second. I think I need to follow up with one comment here. Dr. Marsh just reported we had 27 deaths, and I've just been handed this sheet, and in an effort to completely be totally transparent, the 5 o'clock numbers just came out, and we've now got 29 deaths. And so Dr. Marsh wouldn't have known this. You know, I don't know what to say. I mean, I hate it. I continue to hate it, even though if you look at just stats, the numbers are fabulous compared to others. But I just know every one of these people are a mom or a dad, and they have a name and they have a family, as I've said so many times. They got friends and they've got loved ones and everything. And this disease has been nasty. That's all there is to it. But this is the 27th death was an 85-year-old woman from Jackson County. The 28th death, an 85-year-old woman from Kanawha County. And the 29th death, a 69-year-old woman from Barber County. You know, in just a couple of days, I'll be 69 years old. And, you know, I've got a little grandson and a little granddaughter on the way, and there's so many aspects of life that you think you've got so much life in front of you and so many good things and good times. So our thoughts and our prayers are surely with these people and all their loved ones. And I just wanted to interrupt and tell you that, because it just came to me, and I didn't want someone to come up and ask a question. Well, we hear there's 29 deaths, so it's what it is. Thank you.
Thank you, Governor. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Thank you. Good afternoon, everyone. A couple of quick items. One, an update on the governor's executive order and where we are with regard to testing. We've initiated testing in 38 facilities in the state thus far. We have 11 facilities that have reported completed testing, and one facility has received results. We have no new positive outbreaks at this time as a result of these additional facilities testing. We have actually 680 negative lab results for residents and 706 negative lab results for staff. So thus far, we're showing good results. You'll notice that the number and the percentage of individuals tested for West Virginia is growing rapidly as a result of this. I want to thank the providers, the long-term care, our partners out there, and especially the healthcare workers, the frontline staff of these facilities for cooperating and helping us do this quickly. One other item, DHHR's Bureau for Children and Families today announced the availability of a one-time special assistance payment. This is called the Pandemic Diversionary Cash Assistance. Is available for certain families. This payment will provide families additional financial support to supplement monthly living expenses and other needs due to the COVID-19 pandemic. Applicants must not be currently participating in West Virginia Works. The applicant must have a dependent child in the home, low or no income due to COVID-19, and expect to return to previous employment or have a job offer or expect further income from another source. Must not currently be sanctioned for noncompliance in our BCF program. To apply for this, and I hope we have a graphic ready to show, please contact, I'll give the phone number first. That's 877-716-1212. That number is 877-716-1212. Also, you may log on to the DHHR website, and there should be information there to get you to that documentation there for submission of an application. So that's all I have. Thank you very much. Please stay safe.
All right, thank you. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Taylor Stuck with the Herald-Dispatch.
Yeah, this is Taylor with the Herald-Dispatch. Governor, last Friday the county started getting the $100,000 grant that you had said was for hero pay. Cabell County Commission announced, they put out a press release saying that based on a letter that your office sent, that it is not for hero pay, that it can't be used for hero pay. I got a copy of the letter myself. How I read it, it doesn't seem that this would be a reward for first responders or anybody else. So I was wondering if you could comment on that.
Okay, and it's Kayla, is that correct?
Taylor,
I'm sorry, Taylor. Taylor, I'm having trouble hearing, exactly what you're saying. I've got my general counsel here, Brian Abraham, and he's been very, up on everything that's going on in Cabell County. The only thing I'd like to say is just this. We want to reward those that have stepped up, those that are on the front line battle. We want to be able to do that, but we wanted to be able to do that in a format that we could basically hope that we could get reimbursement at some point in time from the federal government for rewarding our heroes. So in doing so, what we had to do is we had to come up with a way to give the counties discretion, and because we don't know who those are. And we needed the counties, to really be able to help us with that. And so we just did the very best we could possibly do with what we were doing with there. We gave every county an equal amount. I mean, we could have proportioned it, by population, but we gave them all an equal amount because we know that right behind this in this stimulus package, there's going to be enormous dollars that can be made available to the counties. And whether it be the counties, I'm speaking of the counties and all the cities and municipalities as well. So that's all in one, the same thing. But I think, Brian, maybe you have more to comment, and maybe you don't.
Not really, Governor. You answered that perfectly, Taylor. As the governor said, we put that money to the counties as a short-term bridge. There is absolutely money set forth in that, and if the counties want to use that to supplement in terms of they need overtime or whatever for their frontline responders, that's available, and that is specifically allowed in that even by the letter. Some of our counties have let us know they wanted to use that to purchase the PPE to provide to their first responders, and then even beyond that to some of the essential workers thereafter. The governor said he wants to be as lenient as possible and allow this money to be spent for what the counties believe they need to use it for. So we saw Cabell County's press release. Obviously, that was one county out of the 55. We would be happy to work with them at any time, but I think the governor hit it right on the head. He wanted the counties to be able to have the discretion to use this as they need it.
All right, thank you, Taylor. Next, we'll go to Aaron Beck with the Register-Herald.
Hi, Aaron Beck, Register-Herald. Journalists are hearing concerns from our communities that they want a response from the governor about, and we are not able to get responses from the governor about those concerns because a very limited number of reporters are permitted to ask questions at these briefings. Our mics are muted after we ask the question, so we can't follow up and be sure that we understand what was said and get clarity on it. And also because when we send emails, follow-up emails to the governor's office, those aren't returned. So I was wondering if you would be willing to change any of that so that we can get more adequate responses for concerned community members.
Aaron, let me jump in and tell you, there's no perfect format. We've been here every day, and I cherish the fact that we've been able to be here every day. We go on with you as far as all West Virginians in a briefing. It most generally lasts, close to an hour or longer. I don't know, we're occupying very valuable airtime and everything else, and we don't want to take advantage, but we're giving you transparency in every way that we can give it. I'm sure there's enough questions that are out there that we could sit here and this is all we would do and everything, but there's lots and lots that has to be done. We're giving everybody 1,000% transparency, and we're going to continue to do the same thing.
All right, next let's go to Amanda Barron with WSAZ.
Hi, everybody. Amanda Barron from WSAZ. I know that the people who are working in nursing homes right now are obviously exhausted, overwhelmed. Some of them, are dealing with health concerns of their own. Is there any plan that would be possible to allow other workers? Is there red tape that could be cut to allow other workers to help come in and alleviate some of the stress that's been put on those healthcare workers?
Boy, I'm answering a lot of questions today. We probably need to defer that to our healthcare community, but never mind. I'll get back to that in a second. Go ahead, somebody, Clay or someone.
Yeah, Bill, do you want to start? I see you started.
Sure. I'll start, Clay. Let me just say again, those folks are on the front line. It's a difficult environment out there right now. We do know, and we've spoken with providers who have attempted to hire workers, for example, who were furloughed by hospitals so that they could give their staff a relief and let staff take a little bit of time off. That's not been successful. We've looked at guard members. We've looked at a variety of options there. It's very difficult to find individuals and train those individuals and get them into those environments. So it's a great question. I will say they're looking at that, the providers themselves, and we're helping in any way we can. And I want to again say thank you to those people on the front line who are in those facilities and who are taking care of those folks.
Maybe I could just add one more thing if I could. So Amanda, it's a great question. As Secretary Crouch said, we're trying to create some strike teams that will enable and be able to come in either via telemedicine type consult visits or training visits, tele-echo, which is extending community health outcomes. So we're working with the big three systems, Marshall, CAMC, and West Virginia University, to create teams that could be brought in and make recommendations to people. And we're also trying to buddy up larger acute care facilities to part of our long-term care groups so that we can more easily exchange people between the acute health systems and the nursing homes or the skilled nursing facilities as we might have some surging. So we're trying to work on that. I think Secretary Crouch said it very well about the human capital part of the replacement.
All right, thank you, Amanda. Next.
Something else too. I want to add something to that. Amanda, I have said it, and oftentimes it just doesn't seem enough to say it enough, but I have said over and over and over, just think about what these people are doing and what they're giving. Whether they be our first responder or the first line, healthcare people or whatever, just think what they're doing. Everybody in West Virginia needs to really perk up and listen to what they're doing. These people are going to work, and they're working long shift, and they're working multiple days, more in a week maybe than they would normally do. And then we're wanting to try to solicit help maybe from the outside to be able to spell them and give them a break and everything. And it's dadgum tough to recruit. And really these people are coming in, and they came in the beginning and ran to the fire when really and truly the amount of supplies, PPE that we really had was inadequate. And so yet they came, and they continue to come, and they continue to work. And absolutely, we know they're tired, but we should at least bend over backwards to appreciate them and love them. And that's why, even though it's not perfect, the heroes pay, it's not perfect, but at least it's a gesture to say, we love you and we really, truly appreciate you. And the other thing is I would bring to everybody's attention is just this. Just think, what would we do or what would we have done without our National Guard? I mean, think how they have run to the fire. I mean, think just what they have brought to us as far as goodness and help and support, whether it be in workforce or whether it be all over the place. I mean, the things that they have done are unbelievable. And so we have a community of people there that I'm describing, that expands maybe beyond the healthcare, or maybe beyond the first responders, and maybe beyond the National Guard, and maybe it's a grocery worker or whomever it may be. But we really have a bunch of people that have really, really, really saved tons of our lives. And I couldn't possibly be more thankful.
All right, thank you, Amanda. Next, let's go to Charles Young with WV News.
Hi, Charles Young, WV News. I was wondering about the long-term plans that General Hoyer kind of alluded to continue feeding kids after the school year ends, the infrastructure and the supplies that are in place to continue feeding those kids who need meals after the school systems are no longer providing that. Thank you.
So, Governor, if that's okay, I'll start out. So we are working with the State Department of Education, the county school boards, as well as tourism is providing support, putting together the plans for the long-term feeding that is directed by the governor through the operations during the pandemic. You'll hear more next week about those definitive plans, but a lot of work going on right now to address what's the infrastructure needed as well as the supplies. The other thing that continues to go on is regular meetings with volunteer organizations active in disasters, as well as our food banks to sustain initiatives for families in need. And the third component of what the governor's directed us to do is to work with senior services to make sure that the support is in place for that. One of the initiatives that the governor's tasked us to look at is how do we engage local businesses and provide some economic stimulus while we continue to do what's directed to feed those in need throughout the summer.
Okay, thanks, Charles. Next, let's go to Kenny Bass with WCHS.
Thank you. This is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question for Dr. Marsh. When you talk about testing and expanding it once we get past the nursing home stage, there are several groups which probably need attention. You mentioned incarcerated people and people in a confined and controlled situation. There are also assisted living and retirement homes, which did not fall under the governor's order for nursing homes. There are senior community living apartments where many of those serve general areas and have a conglomeration of seniors who are in tight spaces and are around each other. And of course, you have the very vulnerable African-American population in several pockets throughout West Virginia that are more susceptible, at least statistically, to the COVID pandemic than whites or other races. So how do you put those people on a list? Because there's literally thousands that would be included. How do you rank them? How do you prioritize them? And where you get started? If you could give me some idea of what your thinking is, I'd appreciate it.
Governor, do you want to start off? You want me to?
No, Clay, go ahead.
So, Kenny, as usual, you asked a great question, and the answer is we want to test all these folks. When you look at the priority of the list of trying to test these folks, right now we want to finish with our long-term care facilities and get that done. Certainly, it was great we did the VA facilities. We will move forward, and certainly, with Secretary Crouch's input and direction, we will start to look at these other vulnerable populations. I think the African American community here in West Virginia is a really important one that I know, Kenny, you have raised now more than once, and your recognition of the susceptibility of the African American population, along with our elder population, is very well positioned and very insightful. So as we go forward, we want to test people who also want to be tested, and the governor's executive order included all of our long-term care facility people. And certainly we want to work with community leaders and with folks that have, supervisory capacity to make sure that we are doing things in a way consistent with people's freedom to choose. But one thing I will say, and I've said it now more than once, but this is really important. When we get back to reopening, as we're doing now under the governor's direction and his decisions, which I think are always with the best intentions for the well-being and the health of our population. What we've realized from looking at other countries that have done this is the fact that we can't, just by seeing people's symptoms, know who could spread this virus and who can't. So an effective strategy for us is to have a very broad testing plan. And that's the reason why having support from many different types of laboratories is very important. And as we go forward, we will try to test all the people you mentioned. The order we'll try to define both on the sort of the urgency and also the availability. So you're right on target, and more to follow.
Okay, thank you, Kenny. We have time for one more question. Let's go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Brad McElhenney here. As we talk about striking the balance that it would require to reopen the state's economy while also being protective of people's health, when could West Virginians see or hear a laid out set of guidelines and standards for working through that process? The specifics of what we need to hit in terms of health standards and testing capacity, the ability to do contact tracing that would then lead step by step to reopening that economy.
Brad, I think you'll see it. It will be fluid, and it will be changing from time to time, and we'll have to take. I mean, that's the thing, I guess, Brad, that so many people struggle with is they're looking at 3 parts to a 35-part puzzle. But I'm looking at 32 parts to a 35-part puzzle. There's 3 parts that nobody knows anywhere, but we're taking input from other states. We're taking input from our federal government. We're taking input from our experts in every way, and then we're gauging the progress of what is going on with our curve and what's going on in different areas or hotspots of our state or not hotspots of our state. And we're looking and evaluating the possibility of maybe opening up non-hotspots maybe before hotspots, and so there's so many different variables here that the general public, may have it figured out, may think they've got it figured out and looking at 3 parts to a 10-part or to a 35-part puzzle. But the reality is just this. The first thing we did, now just think with me on a timeline. I think the president came out with the guidelines for phase 1, 2, and 3 on Friday night after 6 p.m. And today's Wednesday. On Monday, we came out and said we're going to take and move all of our elective procedures with our hospitals. That's going to be the first move on the chessboard that we're going to do. And we're going to try as quickly as we can to get our hospitals up and operational. Now, during that same time, we also went and put a bold step out there to be able to test everybody in our nursing homes, because when we walked in here on Monday from Friday, when I left you on Friday, there was 13 deaths. And when I rolled back in here, I think that's correct, but when I rolled back in here on Monday, we had 11 additional deaths, almost as many deaths that I had to read off to you. And believe me, to God above, Jim Justice hates that more than anything in the world. We had lost 11 great West Virginians, almost as many as we had lost in 40 days. But yet, we're focused on how fast we can get back to going. And people don't understand that Jim understands the fact that if we don't get back to going, this country could drift into a depression at some point in time, and then the numbers would be catastrophic beyond belief. There's so many things, from drug overdoses to suicides. I get all that. I get every bit of that. But what we're doing, we're trying to put together a format. But it'll only be a guideline. It'll only be a format, that will go out there. We're consulting. We're talking to all kinds of different businesses. We're doing all the stuff that you may wonder whether or not we're doing, but you don't get the results that we're getting by just shooting in the dark. So our people are after it, they're working it and everything, and as soon as we possibly can give you more information, we're looking to open this up. We're looking to, to take this step and try to open this up and this up. That's what we're going to do. And so with all that, I would say in the very near days, you will get more and more and more of a guideline, a roadmap to where we're going, but just be prepared. The roadmap has got to be fluid and have the ability to pivot all the time, because, this situation can jump up and bite us, and we don't want that to happen either.
All right, Governor, I'll turn it back to you.
Well, I don't really have that much. The only thing and I try to make notes as we go through this, just maybe things that we've missed. And, I think Kenny Bass asked a question in regard to the nursing homes and the testing there, and brought up the African-American communities, brought up, the assisted living homes, different other places where we had, seniors primarily and others that had, the abilities that may be exposed in a more dramatic way. Are there things in the pipelines to be able to test others? And I would say just simply this. We have a monumental task in front of us. If we can pull it off this week, I'll be amazed. And it may very well drift in a couple extra days. But if these people can pull off 28,000 tests versus 22,000 that were taken in the 40 days prior, in a week's time, it is an absolute feat that they should be very, very proud of. But as we get that done and we get more data, Dr. Clay Marsh, amongst lots of others, primarily through our contact through LabCorp, now we're beginning to broaden our testing capabilities that are unbelievable in West Virginia. And so as we have that additional capacity, and it's right on our fingertips to be able to have, as we have that, we'll be able to just test more and more and more. And so from Kenny's standpoint, yes, Kenny, we're going to test a whole lot more, and we're going to test those communities that need to be tested. But the last thing I'd say is just this again. West Virginia is a lot of times you're at the bottom of the barrel and everything. In decades past, it wasn't fair, and you had a lot of people kicking you. And I'm not going to tell you the exact poundage, but I've been a great big poundage cheerleader all the way through, because I believe in you. I believe in the greatness that you're all about every day. And I believe in what you've done right here again, the entire world. I was on a radio show yesterday, that was syndicated out of New York City. They're amazed with what West Virginia has done. You, not me, not these health officials. If you hadn't stepped up to the plate and did what you did, we would have been nowhere. You have put your mark in the sand of just how great West Virginians are, just how smart you are, just how good you are in this state in every way. Absolutely, I can never thank our businesses, all the individuals of this state, our government workers, and most importantly, our health care and our first responders and all those that are on the front lines, grocery workers, all the people that are taking care of us. So all I can do, again, is brag on you and just continue to tell the world how great you really are. Thank you a bunch. God bless you.